Welcome to the Healthy Living Series, a series of talks brought to you by the University of Alaska's Summer Sessions and Lifelong Learning in partnership with Foundation Health Partners. My name is Joan Braddock, and I will be your host for this summer series. The Healthy Living Series, in its 8th season, has been a lecture series held in person in past summers. The COVID-19 pandemic and social distancing guidelines required that we rethink the format for the series this summer. We are delighted that KUAC has agreed to support the new format for the series as a weekly TV broadcast. We are also grateful to our speakers who were willing to be incredibly flexible in adjusting to this new format and appreciate the time they are donating to help us all live a healthier life. I am delighted to introduce our speakers for this evening in the last talk of this series. Dr. Mishelle Nace and Dr. David Bridgman-Packer, who will be presenting the second part of their talk on COVID-19 and children. Part 1 of this talk was aired last Tuesday night, but can be accessed anytime from the Summer Sessions' website. Dr. Nace, a pediatrician at the Tanana Valley Clinic, received her medical degree from the University of Washington, Seattle, and completed her residency at the University of Washington's Children's Hospital Medical Center. She is a board-certified pediatrician and the current medical director of the Tanana Valley Clinic Pediatric Department. She has been with TVC since 1996 and is the mother of 3 children. In her pre-COVID free time, Dr. Nace enjoyed spending time with family, running, and traveling. Now she is focused more on family and running. Dr. Bridgman-Packer is a resident physician in pediatrics at the Tanana Valley Clinic, as well as the University of Washington Seattle Children's Hospital. He completed medical and public health school at Columbia University in New York, with focus on health law and public health policy. In what free time he can scrape together, he enjoys biking, hiking, and figuring out how to have fun in our new world of physical distancing. Tonight, Dr. Nace and Dr. Bridgman-Packer will be presenting the second part of their talk on the very timely topic of COVID-19 and children.
So I wanted to talk a little bit about schools. Schools are an important part of society, important for the children, important for the community as a whole. And so as this season approaches and the back to school conversation is there, I wanted to go over a little bit about some of the pluses and minuses and some of the concerns we have regarding return to school. We can agree that school is a fundamental important to child development and well-being, not only for the academic part and the instruction they get, but also from the social and emotional skills that they learn from school. It's also an area of safety for some kids. It's where it's reliable information that they receive and the people that they're with and the lessons they're learning just by being in the environment of other students and teachers. There are also services that are provided through a school that children otherwise might not get, such as physical therapy, speech therapy, occupational therapy. It's a source of mental health support, school counselors, other teachers, and other sources and trusted adults that are able to advise and help kids. It's a source of physical exercise and health, as well as reliable nutrition for some who might not have it at home and are able to get breakfast and lunch in a healthy environment to support. So it's more than just the educational learning. School has been shown of recent events to play a very critical role in addressing racial and social inequities. The ramifications of COVID-19 have definitely, and as well as school closures, have brought about the impact of race and ethnicity in our vulnerable populations. We can see that differences do exist, and school in itself is one of those entities that helps address this. So we know that any school reentry program that we have, it has to be flexible, it has to be nimble, it has to be ready to adapt given what's going on in the community as well as that school as a whole. We have to find a plan that's practical and feasible and able to be appropriate, different for different age kids. What might work for the elementary and the preschool program might not work for the high school or college program. So it has to not only take in the age of the child, but also the developmental status of that child. And again, as I mentioned, we have to give special considerations to those populations and account for diversity, especially the vulnerable. And when I'm talking about vulnerable, I'm including things like the medically fragile, or kids who may live in poverty, kids with developmental challenges, or just health medical needs that need to be addressed, and that is met through the school. We can all agree that our goal with returning to school is to have a safe return to school. And so we can also recognize that there's an internal a conflict with this, in that we want to mitigate spread, but we also have to balance that with the harm of not attending and not returning kids to school. That inherently has harm as well. So with school, one of the things that we have to say is, how can we optimize and get this learning in school, but yet try to adhere as close as we can to physical distancing? And we can agree that that's not always easy in a school setting. So I'll go over some ways in which schools are attempting to meet these goals of providing in-school learning, but also adhering and working towards getting physical distance between students and teachers, as well as taking into account the hand washing, the extra hygiene. Things like keeping desks, although we might not be able to do 6 feet apart, 3 to 6 feet apart is also a goal. To keep kids in cohorts where they stay with that same group of kids throughout the day, so if one gets exposed, we know it's kind of limited to that group of kids. Instituting mask wearing of those who are able to wear those masks to help prevent the spread of kids who may not realize they're symptomatic, or who might be symptomatic but not yet identified as concern for COVID-19. Increasing hand washing, not only being able to wash their hands, but also having hand sanitizer available. Using the outdoors as much as we can, and we know in Alaska that's going to be a real challenge as it gets colder. But it's also known that the more you can be outside, the ventilation of outside is superior than what we get inside. Decreasing visitors being able to come into the school buildings. Decreasing the number of people actually in the building, and that might mean rotating. Some students come to school on some days and some come on the other days. It also means decreasing the time in the building. There might be shorter school days that are utilized in some of the age groups. There are block schedules. Instead of kids going from classroom to classroom every 45 to 60 minutes, it might be that they're going to learn in blocks, longer blocks, 90 minutes, and change less frequently. It might be that the teachers rotate instead of the students. It might be that different forms of PPE are used by school personnel to help protect them as well. It might be that we use one-way halls, that you walk down just one direction, and instead of lockers, there's alternatives for students to be able to store their stuff. It could be a staggered release, that some classrooms are released at one point and then another classroom is released at a different, so you don't have the mass number of students in the hallway changing classes. And there might be things like separate lunches. Instead of using the big common area for lunches, that it's used, but a smaller number of people, so they are spread out, or that they remained in their classroom during to be able to eat lunch. All of those things are different mitigation kind of strategies to help get kids back into school, but yet adapt the school building and the plan within the building to help allow them to have that in-person learning. There will also be some form of entrance to school screening that happens. And as I talked about, screening is a set of questions. It will be a real difficult thing to do that every day in front of a building that houses 1,000 people. For multiple reasons. One, it takes a lot of time to do that, as well as where are you going to line these people up and keep them social distancing as they're ready to answer those questions. So one of the possible plans would be that parents each day screen their children. They'd ask them those questions. They verify that those questions, are you having symptoms, et cetera, as well as perhaps take their temperature. And the agreement would be, if you're sending your student to school, you are saying that my child has passed these screening tests and these screening questions and doesn't have a fever. And that would be the screening that might happen for their school. There's also what happens if a child goes to school, did pass the screening, but at 11:30 now starts to feel ill. They start to have a fever. We have to develop a rapid response to what that case might be. And each of the schools is tasked with figuring out where would that child go? What is the path that we would put that to help mitigate any spread of that child's concern? Another one to go in a little more depth is face covering, which can be a topic that causes a lot of consternation and discussion. It has been shown that wearing a face covering does protect, to some degree, the person wearing the face covering, and to more of the degree, the people around the person who is wearing those face covering. So as this evidence mounts that universal face covering does interrupt the spread of the virus and isn't going to be encouraged in that kind of environment. When you cannot guarantee that you can be 6 feet apart, that facial covering can help with that spread. Now, there are some exceptions, and there are going to be exceptions to who can wear the masks. But they're not recommended in kids under the age of 2. Developmentally, that is not appropriate for them to be able to wear. There are some people who will be exempted by their developmental status or also their medical status. And in that case, that would be a discussion with their healthcare provider to decide, is that someone who fits in that category and wouldn't be able to wear a mask? We need to educate people and kids. How do you wear a mask? You see some of them, they're under their chin, they're over just their mouth, they're over different parts. Is educating, mask education for those, especially the younger kids who might not understand the concept. And then the idea of hand hygiene, in association with the mask, those are steps that we can take to help mitigate, to help keep our schools more safe. The PPE question, we need to have available PPE for for those staff who may be attending to kids to be able to draw on. Our nurses, our school nurses and others who might be in attendance with kids who would be concerned for COVID. Now I want to take a moment and how we would all, in an ideal world, like our kids to be able to attend school. One of the things we can do as a community is keep our community safe. If we can keep our community number down, that allows our kids to go to school. If our community numbers are up and community-wide transmission is at a concerning level, that makes it less likely that our kids can attend in-person school. What we can do as a community, if we take those steps, the physical distancing, the hand washing, the wearing the mask, the staying out of high group situations, that will allow our community numbers as a whole to come down, which allows our children to go back to school. So there is something we can do as a community to help get our kids back to school. As far as the education itself that's going to occur at school, we need to adjust for COVID times. The stress of the virus itself, as well as in school, out of school, what's the assignment? I'm not sure if I have the ability, my computer's not working. There are a lot of different secondary complications that can occur in our COVID times. So by these barriers being there, we don't want to put more stress on a child to learn when there's all these other type of situations. So we need to be flexible in how we have our kids learn. Kids with certain disabilities who already may be behind are going to be even more behind, and we need to allow and stretch to how do we help those kids to be able to keep them from getting more behind. There's the behavioral health aspect for the students themselves. The emotional impact of this pandemic, the financial situations they might have at home, the social isolation of being home and not being able to play with their friends, the racial inequities that may happen, the income inequities there, and they have limited contact with school professionals who might be able to help them. We need to make allowances for that and to help them. They need more access to school counselors and mental health professionals to help get them through that process. Going back to school does not mean that the risk has been eliminated for you to get disease. It means that it is mitigated. We are doing things to keep the number low, but there's no way we can guarantee that the risk is not there. As discussed, patients, students can still spread the virus even when they're asymptomatic, and we might not know who those patients are. There are also students who still remain doing home-based learning, and there might be ones who are struggling with anxiety and depression, and by not having their normal school support, that can become worse. And what academic accommodations are we making for those who do choose to continue with the home-based learning? There's also the mental health of those who are working, the staff, the teachers, the school nurses, those who all have taken on this task, as well as have to support their own needs and the needs of their family. Some have medical considerations like pregnancy or immune concerns, or close members of their family who have immune concerns. There are people just by age-wise who are teaching, who put them at a higher risk in exposure to those children. These risks lead to stress, and it makes it their job that's already difficult. On top of that, they need to learn how to teach not only to a classroom, but to an online classroom and to kids who might be at this level or might be at both. And that's a complicated issue and a big ask of those teachers. Another issue to address is food insecurity. So there are many families within the United States. It's estimated that 1 in 7 families has food insecurity, meaning these children are not sure where their next meal might come from or the content of that next meal. And schools stepped in to help with that. Schools providing breakfast, providing lunch. In those kids at times when they might need to be quarantined at home, or their families might have to choose for them to be at home, they don't have the meals provided. What steps are being taken so that we can also provide food to help with that inequity? Given that some of those families who previously were able to provide that food, but now given to COVID times and job insecurity, are no longer able to. So the number of kids who might have needed before food supplementation, that number is going to increase. And how are we going to meet that need? And another one that's near and dear to our hearts as pediatricians is immunizations. A lot of patients and families felt uncomfortable returning to the medical office to get immunizations and well child checks that were needed but had to be put off due to concerns about actually being exposed to this virus. Now that we know more about it, we are able to take steps at these clinical offices as well as in the hospital to help with that. There are screenings at the door. There are questions before you're even coming to the building. And then there are steps in terms of increased cleaning, staff wearing certain inappropriate PPE, distancing patients and not using the waiting rooms to the degree we did before. Those are steps that make it a safer environment to come, and we strongly encourage to get back on track with those well child checks. It's not just about immunizations, it's also about screening for vision and hearing, as well as taking care of your teeth and your mental health needs. There are many more things that happen at a well child check that we want to make sure people are still getting those needs met. Regarding immunizations, we strongly encourage the school district still to support regular immunizations as they have before. And then additionally is to more strongly recommend the flu immunization. So flu shots usually become available in the fall, sometime in late September or October. This year, stronger than ever, we are encouraging getting the flu shot, and that's for multiple reasons. The symptoms of the flu largely are consistent with also symptoms of COVID-19. So we're not always going to be able to tell which is which. So sometimes having the flu could land a person in quarantine because we're not sure which one it might be. There's also concern in some studies that you can get both the flu and COVID-19 and be positive for both, and potentially the severity of that condition could be even stronger. And we don't want to see children go through that experience. So we are strongly encouraging, as the flu immunization becomes available, to get the flu shot to help protect you and those around you, especially those who might not be able to do the flu shot. Those are available at your regular clinic office, and although at times public health might not be able to focus on giving those immunizations because some of their time might be spent in contact tracing, it is the hope and the goal to get public health also taking care of those immunizations as well. So if you're not sure what's available, you can reach out to your healthcare providing office and ask, where can we get those shots? There are numerous flu shot clinics and walk-in clinics available that you can get those flu shots in. Going back to school is going to be different. There's no doubt it is different. We have to change our expectations of what school is. If you think it's going to be like it was before in this next time period, it's going to lead to unmet expectations, which also leads to frustration. What we're asking is for you to give a little grace to the school district, and those making those difficult decisions regarding going back to school. They have the same goal as parents do. We want our children to go and be able to learn in a healthy environment, to not only learn academic learning, but also to be able to socially be intermingled with their friends. That degree is going to change when we first start going back to school. We need to be able to be flexible to navigate those changes. It might be that we're doing in-person school, and then what happens is something occurs in our community or that school that we have to switch gears, just like we do when we have snow days or cold days that we're not able to go to school. That's going to happen during this COVID-19 pandemic. There's going to be frustration on a daily, weekly, monthly basis as we all fight against how do we reprogram our mind and our plans, which COVID has derailed. There are going to be perceived inefficiencies and disorganization about those and school choices, meaning going to school, not going to school, how many hours, times they do it, when is it open, when is it red, when is it green, when is it yellow. That's going to lead to frustration, and it's not always a black and white answer. We need to allow each other grace. We need to allow ourselves grace and know that we all have that same goal going back to that. Even though there is frustration in those steps, the goal remains the same. We need to remember that COVID is a tricky virus. It not only affects our body and our system in illness, it affects our ability to plan and organize in the way in which we're used to. It is going to try to change us as a community, but we need to go back to that same understanding. We have the same goal. We want to get our children back in school. We want to get closer to what we remember as our normal. But we can't always do that in the rapid rate in which we might want our kids to experience. So we know that if we work together, if we plan together, if we grant grace together, and if we stay together as a community, we can get our kids back to learning and in the best environment that's safe for them. So I wanted to take this time and talk a little bit about the difficulties that both children and families face as a result of this pandemic. And a lot of the information I have is from a book by Dr. Kenneth Ginsburg called Building Resilience in Children and Teens. And he has some great ways and some great concepts that really apply to our pandemic and what we're going through. As parents, as teachers, as grandparents, as anyone who cares for kids, we want to protect our children. We don't want them to have to witness, certain things and certain disappointments and suffering. And COVID-19 kind of puts it out there in different forms. We wish they didn't have to have things disrupted, seeing their friends, graduations, get-togethers with friends, birthday parties, that now we've had to see morph into a different plan than what we had and they had envisioned. So we've learned that we cannot control these circumstances, But what we can do is we can work together to strengthen our relationships during this time period and to help build our children's resilience. And that's what I want to talk about. What are some things we can do to help build our and our children's resilience? If you can remember a time when you might have heard the phrase, this too shall pass, as a common thing, maybe some other generations might have got it. You'll get through this, we'll get through this, we'll do it together. That is the kind of theme that we're talking about with COVID. One of the best ways to help protect our kids is to help shape the lessons that they're learning during this difficult time. One of the things that my kids would tell you that I do is what's called a twisty hand, that you can take one thing and depending on how you twist your hand, how you receive that, and then impart that can depend on which direction you turn your hand. And what I want to talk about is how can we take one thing and twist our hand to change the perspective to perhaps have a learning lesson that can help our kids in a lifelong pattern. So I'm going to go over some of the feelings that might come to people's minds or some of the feelings they're experienced both from a parent, an adult, as well as a kid, and talk about how can we shape that into a life lesson. Maybe by seeing some of these experiences and changing this perspective, we can have a stepping stone to teaching lifelong resilience to our kids. So one feeling that might come is the feeling of, I feel like I am failing. This could be an opportunity to learn self-forgiveness. In COVID-19, perfection is just not an option. You can't make it perfect for your kids or for yourself. But you can focus on what is good in you and have your children see you focus on what's good for you and give yourself compassion. Kids seeing this might, over time, also be a little gentler on themselves, as we know that if you give yourself a break, kids sometimes learn the most when we're not trying to teach them anything. And by watching you as an example, they can incorporate this into their life as well. Another one, my kids are so frustrated and so am I. This could be an opportunity to learn to empathize. One of the most respectful kind-hearted thing a person can do is to genuinely try to understand something from another's point of view. When you give time to hear, to listen what someone else is saying and try to understand it, that is a gift. When you build and help your kids understand empathy, they are understanding their own thoughts, their own feelings, as well as the feelings and behaviors of others. There's this one. I don't know how to handle how I feel right now. This is a lesson in how to process and release emotions. In times of uncertainty, our emotions can run wild. These emotions are not to be ignored. When we take our emotions and stuff them down, squash them down, it's a sure guarantee at some point they're going to come back up, and maybe in a way in which we wish they didn't. We need for our children to understand that having emotions are good. Talking about them is even better. And being honest about them and processing is healing. And we have the opportunity to teach them that. And this one from parents. I want to pull my hair out. This is totally understandable. And this is an opportunity to create a safe haven within our home. We all have bad days. We all have times when we're excessively stressed, and COVID gives that to us. We cannot control what's going on in the outside world, but we do have the opportunity to create sanctuaries in our own home, to create peace in our home, to give kids a base where they know at this point, in this area with these people, I can handle it because I have strength in my foundation and my base. I need a timeout. How can you be a presence for calming others? In the moments when our future is unclear, when our tomorrow is unclear, when our next hour, when our going back to school, when can I go on an airplane, when can we see grandma and grandpa, we race towards the worst case scenario. This is an opportunity as a parent, as a friend, as a grandparent, to be the presence and a voice of reassurance. And that can make all the difference to a kid, is to use this time to reassure and be a calming force for others. Parents can sometimes say this: I don't know how to respond to what my kid just said. Being clear and being honest with yourself and your kids is the time to do this now. You may know the answers to some of the questions, and in an age-appropriate way, you want to share that. But you also want to have the ability to say, I don't know the answer to that. That is a good question. What other questions do you have? You are being honest with your child when you don't know the answer, and letting them know that it's okay not to know the answer, but what other else questions do they have, and let's talk through this. Another problem sometimes, can you feel that my mind is out of control? Maintaining your physical health helps maintain your emotional health. Strong bodies keep strong minds. They help us navigate circumstances better. It's easy sometimes to sit on the couch and say, I can't go do nothing, I'm staying right here. But there is power in saying, I am getting off this couch, I'm going out to exercise. I know that if I don't take care of my body, I can't focus and I need to do something about it. That sometimes is a hard step, but it's a powerful step. If you help maintain your physical health, you help maintain your mental health as well. There are times when you just keep thinking about the worst case scenario. This is an opportunity to help your kids to stay present and live in the reality. Uncertainty out there certainly can make us most stressed. We think about the worst possible outcome, and so do our kids. You try to catch yourself when you're doing that and say, I know I'm imagining the worst. Let me focus on what now is really happening. Young people have a propensity to assume the worst, as they have not yet had the experience that we have as adults, to go through crises and be able to look back and say, crises come and they go. They don't have that same kind of perspective we have, and it's up to us to say, you'll get through this and I'll be here with you. The statement of, I feel helpless. Finding out what can you do. Nothing creates more discomfort than knowing and that feeling of you just have too much to do. You can't calm yourself because in some ways there's nothing you can do. The thing that can help restore that is finding and tackling something you can do. It might be a small step, not the big step you want to accomplish, but a small thing. There is also calming words you can do. When you hear the statement, I'll never see my friends again, you can help replace the word never with gently using the word yet. I cannot see my friends yet. Yet implies that there is a future, there is hope, and that there will be some day when you can. So try to exchange that word never in a sentence that also includes the word yet. That helps them understand that although they might not be able to do it right now, they will be able to do it in the future. You view these setbacks and these things that they're talking about as opportunities to try yet again. It's not always easy, but they need that source and they need that hope to be able to look into the future. This is a common feeling parents can feel. I can't do everything. At this time, you need to learn to let some things go. You want to stay strong and you want to be compassionate, but you also need to be compassionate to yourself. Find some things that you can do. Take care of others. Reach out to those around you, those who might be more vulnerable or need help as you do. Do what you can to keep yourself going and learn to let go some of those things that might not necessarily be needs, so that you can focus on yourself. And this statement we've heard from so many adults and kids. I am just so disappointed. Try to find joy in giving service and to maintain a purpose. Help your children understand how good it feels to perform a service. That service might be calling a grandparent. That service might be raking someone's yard. That service might be something that they can show that I have done something else to bring joy to another. I have done something else for someone to show that I value them. Through that process, that helps kids and that helps adults as well. And this quote, I've had so many plans that just aren't working out. The lesson is, when you can't change things, you can adapt. Focus on what you can do. How can you adapt that event and still make it worthwhile? You can look back at the past 4 months that we've had many adaptations of graduation, of parades, of visits, of Zoom birthdays. There are things you can do. There are steps you can take that if you can't do the event that was before planned, how can you adapt that event and still give it value? I miss my family and friends. This is a time to realize that relationships strengthen us. When times get tough, this is the time that people need to unify. And it doesn't necessarily mean you have to unify within physical distance. We can still hold each other near without being physically in the same room. We can reach out with letters, we can reach out with phone calls, we can reach out during the computer. It's a time to give those who are vulnerable that extra support they need and they deserve. And then there's a question, will things ever be the same? This is a time of lesson of giving hope. Resilience is more than just bouncing back. It's about adapting and growing, becoming stronger. And isn't this what we want our kids to be able to do? This is our time to realize that uncertainty certainly can be frightening, but we are not alone, and not being alone can bring comfort. We need to find times to also build strength and to do things like grant grace to those who might be annoying us or might appear that they have made a rule or something that we don't agree with. Grant grace to someone who loses their temper just a little bit sooner, because we know that we're all under stress. Grant grace to yourself. Give yourself a break. This is a difficult time, and to accept that it's okay to be sad. When a child comes up to an adult and it might seem like a small reason in which they're sad about because they've missed a play date or they've missed an event, and words that come out of your mouth might be, well, at least you're not sick, at least you're not dying. In that moment in time, that event that child has missed is as big as anything they can see. To validate that, to tell them, yes, that might be difficult. I'm sorry that had to happen. Talk to them about that. Let them get that emotion out. This is the time to let people voice their disappointment and their struggles. It's also a time to help them find gratitude. Find gratitude in what things have happened as a result of this virus. Friends that you've made through one venue or another, common connections you've made, connections that you've, and discoveries you might have made creativity-wise. Find gratitude in those moments and celebrate those moments of gratitude. This is the time for us to come together as a community, because only by coming together, both as a family community and a larger community, can we make it through something like this pandemic. Thanks. So we're going to take this opportunity to answer some questions that we had collected prior to lecture, given that we're giving it via video and not in real time. Some of the questions are from kids and some are from adults. So we're going to start out with some of the kid questions between me and Dr. Bridgman-Packer and just choose some questions to answer. So I'll turn it over to Dr. Bridgman-Packer, who will read a question and then answer it.
So first question we have is, can you get it from sharing drinks, food, pencils, etc.? And what we know is that, as we talked about earlier, when these droplets land, they can land on anything that's in front of us. And so certainly when we're at school, they can land in our pencils. When we're in the cafeteria, they can land in our food. And then anything that has touched our mouths has potentially been exposed to that virus. And so unfortunately, the answer to this is yes. Yes, people can get it from sharing drinks, from sharing food, from sharing objects, and that's why we recommend trying to keep everything as clean as possible. Cleaning your hands, cleaning the surfaces in front of you, and cleaning any objects that you're sharing with others.
I have the question, what would happen if I or someone in my family gets the virus? And that's a great question and a long answer. A lot of people who get exposed to virus don't even get symptoms. Some people who get the virus will have symptoms like a cold symptom. It'll just feel like what you may have had in the past. Some people it hits a little bit harder and they have a little more trouble with feeling really tired and may have congestion and cough. Some people have a little more difficulty with breathing. And so depending on who the person is and what their health status will kind of lay out what kind of symptoms they get. So a lot of people get it, and it just is an experience they have, like they had a cold, and then they get better. But there are also people who get it and have much more severe symptoms. And so that's why we're trying to keep people from getting it, because we don't want some people to have those severe consequences of the virus.
I have a question that says, do you have to wear a mask outside? And I think more important than wearing a mask inside versus outside is making sure that we're wearing masks when we're around other people. It's really is a sign of respect that we have toward other people, that we're taking this extra step to make sure that they're safe, and also to make sure that we're safe. Masks can be really annoying. Now that working in clinic now, we're wearing masks every day. So I used to get really annoyed wearing that mask, and then now it just sort of feels like another thing that I put on in the morning. So I put on my shoes, I tie my shoes, I put on my shirt, I put on my mask. And now, actually, sometimes when I'm not wearing a mask, it feels a little strange. It feels like sometimes when you wear that watch for a long time and then you take it off, your wrist feels a little funny. That's sort of where I'm at with wearing the mask at this point. But the biggest thing is to find a mask that fits you, that is comfortable, and then to wear that so you can protect yourself and you can protect others.
My follow-up question to that would be, why do some people not wear masks? And that also is a great question. There are different reasons why someone might not wear a mask. It's not in every city mandated that people have to wear a mask. So some people choose not to wear a mask. There are also other medical reasons why someone might not be able to wear a mask. So some of those medical reasons might be just your age. Those kids are less than 2, we don't want them to wear a mask because we don't feel comfortable that they are able to take that mask off if they need to take it off. There are some kids who developmentally aren't able to keep a mask on and don't understand it, why the mask is there. So it causes more harm than good to put that mask on because they might be grabbing at it. There are also some people who have some medical conditions, maybe related to their lungs and their breathing, that they aren't able to wear a mask, how it impacts their medical condition. So what we also want people to be aware of is that there are some people who can't wear a mask. They might want to be able to protect, they might want to be able to respect other people, but they can't for a medical or other reason. So picking fun at someone who's not wearing a mask or teasing them or shaming them isn't a good way to treat a person. We all want to be treated with respect. And so some people truly have a reason in which they cannot wear a mask. So we need to do what we can do best, which is wear our own mask to protect others as best as we can.
Dr. Nace, I have a question that is stumping me.
Okay.
Do you know what color the virus is?
I am so glad you asked. So one question was said, he's really confused about what color the virus is because on one article it was purple and then he saw it in the paper and it looked blue, but the emoji is green. So what color is this virus? And I think that's an excellent question. I'm going to have to defer to my partner, Dr. Bridgman-Packer. What color is it?
I have no idea. One of the challenges with this is that when we talk about infectious diseases and viruses and bacteria, these are things that we just can't see. So we don't know what color the virus is. But I think that's a really interesting question.
I think they stumped us. I think so. All right, let's find one we can answer. I have a question. Do you have any idea when the vaccine is going to be developed? I'm going to turn that one over to you.
Yeah, so Right now, we don't have a cure for the virus, and we don't have a cure for COVID-19, the disease. But a big hope among a lot of us in the medical community is that we are going to be able to develop a vaccine that can prevent people from catching the virus and from developing the disease. There are a number of different potential vaccines that are being developed around the world. These are still in the process of being built and created. And after a vaccine gets created, it needs to be tested so that we know that it is effective and so that we know that it is safe before it gets offered to us and before we can use it. And so there are a number of different potential vaccines that are still in that testing phase. The general time frame that we've heard is that sort of 12 months to 18 months from the start of the pandemic. But this is just a guess. And this is already so much faster than we've seen other vaccines get developed, which usually take 5 or 10 years from when they first start being developed until they're available for the public. And so the biggest thing that we can do while we wait for a vaccine is take all of these other steps to keep ourselves safe and to keep our friends, keep our family safe. I hope that we're going to have a vaccine soon. I think Dr. Nace hopes we're going to have a vaccine soon. But at this point, we just don't know. And so while our scientists continue to work on that, it's going to be our job to keep each other safe.
I have the question, are we going back to school? The answer to that is yes, we are going back to school. We just don't know exactly what going back to school means. We are going to start learning again at the school time, and that might be that we do some virtual learning and at-home learning. And eventually, as it becomes more safe in our community and the spread of the virus has settled down a bit, then we will be working on our ability to get back into the school buildings to do in-person learning. We know you're going to go back to school. Kids are going to go back to school, but they're going to go back to school when it's safe. And that's the best environment to learn in, is one in which is a safe environment.
You know, Dr. Nace, you've lived in Fairbanks for a little more time than I have.
True dat.
So I'm curious, when winter comes around, what are some things that we can do when we can't go outside?
That is a great question. Again, all these questions are great. They must have been written by children. I think that this is the time to be creative. This is the time that we need to dig down, just like when it was minus 50. What are the things you do when it's so cold outside that you can't go outside? I think a lot of those events have already been happening over this summer in terms of people been using their computers in a way we didn't use the computers before. Zoom meetings and Skyping people who before didn't even know what those words meant. It's about how can we plan something that maybe you can't stay outside the whole long time, but you can go outside for a little bit and still be able to go outside. It's planning things around your family. It's baking, it's cooking different dinners, it's playing card games and other games at home. It's the things that you need to do to keep you and your family safe. If you have other ideas, it's sharing them with other people. How can you reach out to other people and make them feel cared for, whether it's a grandparent, a friend? It's including others without having them physically in the same space as you. So there's lots of different ideas, and I encourage any idea you might have as kids to share them with other kids and see if they can't do them as well.
I think that sounds great.
You know what I want to know? This kid's question. Why did this have to happen?
Yeah. That's a really good question. You know, we know that there are a lot of different viruses out there that can make us sick. Most of us get a few colds every year, and each one of those is another virus. And we know that there are all sorts of viruses out in the world, some that don't make us very sick and some that can actually make us really sick. And we know that these viruses can start off in one part of the world and move very quickly to another part of the world. And so once in a while, one of these viruses comes along that really challenges our ability to control it and really disrupts and changes all the different ways that we were used to living our lives. And we know that from history that every once in a while, every few decades, every 100 years, every 200 years, one of these viruses or one of these infections comes along that really, really challenges us. And this might be a once-in-a-lifetime moment. This might be the one time in our lives that we realize we have to make a lot of changes in order to get ourselves through this, to get our friends through this, to get our communities through this. So I don't know why this happened, but with where we're at right now, there are some things that we can do to work together so that we can make sure that we all get through this.
How about we take and switch on over to some questions that parents might have?
Absolutely.
Okay. There's a lot of questions regarding masking. Maybe we could kind of put those together. The first one is, I have on it, is it better to have a cloth mask or a surgical mask? That question that we brought up earlier, what I have is a cloth mask right here in front of me. What Dr. Bridgman-Packer has a surgical mask. There was, towards the beginning especially of when this pandemic happened, an incredible shortage of surgical masks. So the plea was to save those masks for medical providers, for people in the healthcare industry to be able to use them, and for people who are going back and forth between the store to use out in public was to use cloth masks. So that is still the ask. The ask is to use cloth masks. There are many more available out there, and there are also now more medical masks. Still, some communities are short on the medical masks, so the ask is still to wear these. And asking the question, which is better? What is better is just to wear a mask. Better is to be able to cover so that your secretions that come out when you talk, laugh, breathe, sing, cough are protected and kept within here so that they don't infect others. Do you want to grab another mask question on there?
Oh, let's see. There's a question of when shouldn't I wear a mask? And these are choices that all of us need to make about when the right time to wear a mask is and when we can take that mask off. A lot of us live with families, and we have our little COVID bubble around our family where we want to make sure that we all stay safe together and that the virus remains outside of our family bubble. And for most people, it works to not wear that mask at home and to not wear that mask around family members. That changes a little bit with folks like grandparents or people who don't live at home with us, who we visit once in a while, who we might want to make sure that we're keeping safe when we're visiting. And so that might be an opportunity to wear a mask. Do you have other thoughts on that, Dr. Nace?
The other time is you don't need to wear them when you're sleeping. You can take, if you're in that situation, we don't want you to be wearing them when you're sleeping. If you are going out by yourself, a recommendation that can be is take a mask with you. If you're out and you can guarantee that you can remain 6 feet from others, you can take the mask off and you can breathe in the outside air. That feels good. You have it there though and available. Should you become closer than that 6 feet, then you can pull it out and put it on, but that you always have it with you so that you can use it to protect others when the case should be brought up.
There's a really good question from parents about screen time, because that's something that we talk about a lot in our well child visits in clinic, trying to minimize how much screen time little kids get. But the question here is how do we balance screen time with now that school is on the screen and now that kids are spending so much time at the computer doing remote learning? So I'm curious, Dr. Nace, what your thoughts are on what screen time means now for kids and for families.
It does make it kind of muddies the water of screen time and balancing outside play and play with friends when we're telling you to not play with friends. So I think this is going to have to come down to a judgment within the family. We still want to encourage that kids have ample time without the screens to still interact with those in their family, to be able to play games that you can physically touch and play with, to do other experiments that the family might have, whether it's within a cooking, whether it's in a craft. And so the rules do change a little bit. We're not going to have as strict recommendations as we say, only have this much time or this much time, because the lines are blurred. So what we're asking for is still think about how much screen time that a child might be getting. Still ask yourself, have they tried other things, going outside and being able to play in a safe environment, or doing some other kind of intellectual learning that doesn't involve a screen. So the exact number you're not going to get, because it depends on how much learning they're doing, how much activity they have on that. Are they interacting with grandma on Zoom? Are they having a Zoom birthday party? So I think that's where parenting comes in and makes those decisions. What's the best choice for my child right now in this environment?
There's a question here about if there are any medicines that prevent or treat COVID-19. At this point, we have not found any medicines, any pharmaceuticals that prevent infection or decrease the risk of infection. For cases of severe COVID-19, we do now have a couple medications that have been shown to be partially effective in reducing the severity of the disease and reducing the duration of the disease. That being said, we don't have a cure. All of the medicines we have are just are supportive and are beneficial, but we do not have a way to cure COVID-19. A tremendous amount of research and a tremendous amount of research time is going into the process of exploring and developing and building new preventions and new treatments for COVID-19. But at the moment, our tools are still limited.
There's another question about a mask, which I hadn't heard before, and it's how do you communicate to someone who's not wearing a mask that you don't want to be around them? Is that a boundary? Is that something you can communicate? And that can be a difficult topic to bring up to someone, because you kind of don't want to insult them, but you also have that feeling and concern for your own health that you don't want to be in that same bubble as them for fear that there might be virus spread. One of the things you can do is you can back up. You can avoid and move back. If that person coming into your space is just a step back, still have the conversation, but back up into that safer distance behind them, in front of them or behind them. The other thing you can do is use I statements. We don't want to accuse people. There might be reasons in which they're not wearing it. You can use a statement if asked, I feel uncomfortable, I'm concerned about, this causes me anxiety, I'm going to move back, as opposed to saying use statements of, you're not wearing a mask, that's wrong. You can use your I statement saying, this is just how I feel. You can't argue with how someone feels, they just feel that way. So if you say, I feel uncomfortable, I'm gonna back up, or I feel uncomfortable, I'm gonna move away, those are okay statements to use. And it's just treating people with respect as well. Also making sure that that one person you treat with respect is yourself as well.
There's a question, do masks help when kids mess with them all the time?
That's a good one.
That's a challenge. When we have this thing on our face, especially if we're little kids or like me, adult kids, it can be really frustrating and it can be itchy. I know my face tingles sometimes. Sometimes at the end of the day, I have a little mask breath. My acne is breaking out now because I wear the mask all the time. But we want to try to work with kids to encourage them to understand that the mask is something that we're wearing to avoid the virus, and also something that we just need to leave on our face. So we can mess with our pants, we can mess with our shirts, but we need to try to leave that mask alone.
Are there any other questions to our large crowd here today? I hear no other questions. So thank you for your time, and I hope that you've learned a little bit more about COVID-19. And if you are interested, there's a lot of information on the internet as well that we'd like to encourage you to look at. Some of the sites that we found the most helpful are sites that are put out by the CDC. sites for the state of Alaska, which is the DHSS website, and sites put out by the American Academy of Pediatrics, or AAP. Those are 3 reliable sites that a lot of decision making is used from the input of those different organizations, and present the information in a very readable way. Thank you. That just doesn't happen like that, does it?
Did someone do that, or was that just?
No, it's on a sensor, so
Oh.
you guys were sitting, nobody was
Still?
moving, and that's why.
Well,
It was perfect timing.
I'm gonna put on my mask because my mask protects you.
And my mask protects you.